now present For the Record with Neil Heinen.
100 years is a long time. It's not as old as the dinosaurs, but it is older than my mom. My name is Evelyn, and I'm here to tell you about me and my friends. Some of us got sick, and some of us got hurt. All of us got help at American Family Children's Hospital. This is my friend Soren. Because of his favorite doctors and nurses, he gets to go to school. Here's my friend Ezekiel. Because of his liver donor, he got a transplant, and now he can play soccer. This is Alyssa. When she was 16, she got a brain tumor, but because of her neurology and oncology team, she got to graduate from college. This is my friend Omar. Because of the nice technicians who helped him with his radiation treatments, he can go to school and play with his friends without being scared to get their germs. This is Bowden. Because of all the people at the hospital who took care of him when he was just a tiny baby, he can play hockey. And here's me. Because of my favorite nurse, I get to be on the cheer team. My mom always says it takes a village. I think that means that a lot of people have to work together to make a great kid. All I know is that so many people help me and my friends at this hospital, and that we just want to share our stories and say thank you.
100 years of kids, care, and courage. Celebrating the centennial anniversary of the American Family Children's Hospital is next on For the Record. Thanks for joining us. I'm Neil Heinen. That wonderful video, an amazing young woman said it better than I could. The talented and dedicated and passionate professionals at American Family Children's Hospital are remarkable. The young people receiving health and hope from that care are an inspiration. At a time when we tend to view health care through a lens of cost, access, bureaucracy, and politics, we too often overlook how far we've come and the quality of our health care today. And nowhere is that more apparent or true than children's health. 100 years ago, the stories on that video were unimaginable. So we'll talk about where we've been, where we are at American Family Children's Hospital, and where we're going, as I welcome to For the Record Chair of Pediatrics, Dr. Ellen Wald, pediatric oncologist and chief of research for hematology, oncology, and bone marrow transplant, Dr. Paul Sondel, and chief of general pediatrics and adolescent medicine and national expert on teen mental health, Dr. Megan Marino. Thank you all very much for joining me.
Thank you.
I love that video. Just looking back at 100 years, we're not going to capture all 100 years in this half hour, but when we talk about major advances, you know, really groundbreaking advances in children's health care over 100 years, what are we talking about, Dr. Wald?
You know, I think there are some big issues like public health and sanitation, hygiene, nutrition that help everybody do better. But from the medicine perspective, the really important issues were the evolution of immunizations and antibiotics. And both of those really sort of came into being between 1940 and 1970. So we had quite a few years where we didn't have them at our disposal. And they have just made a huge impact on child health. So that now we have 15 vaccine-preventable diseases which regularly kill children. Diphtheria, pertussis, whooping cough, different kinds of meningitis, measles, tuberculosis, polio. These were really killers of children.
I mean, and that must have been just total change in perspective for physicians, for healthcare professionals looking at how to take care of children. All of a sudden, your entire perspective changes.
Yeah, it's pretty amazing, and it kind of allows you to focus on other things. And I think in that period, then we began to do a lot better with salvaging premature babies. You know, that would be another major cause of death early on. In the first half of the century, premature babies did not do very well if they were much less than 28 weeks gestation or even 30 weeks. And then all the birth deformities that we're now able to take care of really has changed the complexion of the medicine that we practice.
Yeah. I'm interested in both of your perspectives on this, Dr. Sondel. I mean, when you think of what has really had such a big impact on the work you do today, what would you point to?
Well, I'd agree first with Dr. Wall that the impact of infection disease control through antibiotics, through vaccination, and through the societal measures of avoiding exposure and proper health hygiene and practices, that made a huge impact between 1920 and 1960. In the area where I'm working, in the area of childhood cancer, in 1950, the diagnosis of a childhood cancer was a death sentence. Back in the 1920s, children were dying of infectious diseases. In 1950, and between 1950 and now, despite progress, more children are dying of cancer still than any other medical problem in the United States and in the developed world. But because of progress, and we'll have time to talk more about that, we're doing so much better. The goal of this therapy is to change the way we look at cancer. In 1918, when a child heard, or parents heard that their child had pneumonia, they were terribly scared because that meant all too often a death sentence. Now people hear pneumonia and they know we can handle it. It's not trivial, but we can handle it. We'd like to turn cancer into we can handle this.
Yeah. And just from your perspective, from the work that you do, Dr. Moreno, what are some of the pivotal developments here that have had an impact on your work?
Well, I think as an adolescent medicine physician, my specialty didn't exist 100 years ago, and adolescents were really treated as adults at that time. And so allowing for the understanding we have in child development that children go through stages of development and their care might need to change based on that stage of development, and having expertise across those different stages of childhood has really transformed not just the way that we provide medicine to kids, but the way we provide care to kids, to match that developmental stage and what they understand.
Isn't that something we still have to kind of remind ourselves, is that these are not little adults that we're dealing with here?
Right. Right, and the more that we can be in tune to what they understand and what sort of information we provide them, the better we can partner with them on their care. And I think that also involves the engagement of parents in their care. I think we've done a lot over the last 100 years to find ways to have parents be more knowledgeable, more involved, more partners in decision-making around the care we provide for their kids.
Part of the celebration of this anniversary will allow us all to look back at some of the pictures of the buildings over the last 100 years. When we come back, I'd like to talk a little bit about what's available now, the amazing things available at American Family Children's Hospital, and we're going to do that right after this.
For the Record, sponsored by MG&E, your community energy company.
Did you know 50% of your body weight rests in the middle while you sleep? That's why Sealy's exclusive Posturepedic technology reinforces the center where you need it most. But don't take my word for it. Come to Denver Mattress and see for yourself. Plus, get a free $200 Furniture Row gift certificate with the purchase of select Sealy hybrid mattress sets, and rest easy knowing every mattress comes with our 365-night better sleep guarantee. Shop Sealy at Denver Mattress today, the easiest way to get the right mattress.
The all-new Silverado HD adds to the legendary capability of the strongest, most advanced Silverados ever. With best-in-class camera technology and larger, more functional beds than any competitor, the only truck that can compare to a Silverado is another Silverado.
Truck Month is the right time to get behind the wheel of the Chevy Silverado. Now get 0% financing for 72 months plus $500 cash allowance on all Silverado 1500 Crew Cab pickups. See your Badgerland Chevy dealer today.
Getting the F-35 will ensure the longevity of the fighter wing.
Noise impact will be immense.
This building gives families hope.
We've got a crisis. We really need to increase our staffing.
Take a look at this agenda.
Our job is to make sure we return those funds back.
It's not too early to think about flooding.
Everybody's got to be prepared.
The number of influenza cases is up substantially in our area.
Warning Things look a little different in every household, but weekday or weekend mornings, most of us just want to know what happened overnight and what's up in the day ahead. So turn on News 3 Now this morning, 7 days a week, for everything you need to plan your day. Away from your TV? Not a problem. Get breaking news, weather alerts, and political coverage from the award-winning News 3 Now team. Plus, all things Madison. Stay connected anywhere with Channel 3000, Madison's #1 digital news source.
2020 is the 100th anniversary of the beginning of Children's Hospital, now American Family Children's Hospital, on the campus of the University of Wisconsin Hospital. And we are celebrating that anniversary. There, in fact, is a picture of the very first building, Bradley Hospital, named for the Bradley family. And the daughter who died, I think, at the age of 9 or something of meningitis, and her parents started that hospital. My guest, Dr. Ellen Wald, who is the chair of pediatrics at the hospital, Dr. Paul Sondel, who's the chief of research of hematology oncology, and Dr. Megan Moreno, who is the chief of pediatrics and adolescent medicine. So just looking at the pictures of the facilities, how has that changed? How has the physical environment changed, other than amazing technology, in terms of the care of children and adolescents?
Well, you know that first Bradley Hospital had about 40 beds. And the kids who were hospitalized, none of them had acute illness. I think all the children with acute illness, diphtheria, scarlet fever, whooping cough, they were dying at home. They were not coming to a hospital, and we wouldn't have had anything to do for them if they did come to a hospital. So the kids who were in the hospital were getting some orthopedic procedures, were getting rehab from polio. There was some minor surgery being done, cleft lip repair, some other orthopedic kinds of things. So really no acute illness at all. And when you think about it, you know, the things that are so fundamental to us taking care of a child with acute illness, intravenous fluids for children who get dehydrated either from diarrhea or just from overwhelming illness, the ability to give oxygen to someone who's having respiratory distress, or to be able to support them with a respirator if they get into respiratory failure. None of those things are available. So bringing a child with severe sepsis, severe bacterial or viral disease, there wasn't much to do. In contrast, I mean, now we have everything. And of course, many of our beds are critical care or intensive care beds. So we have a 24-bed, what we call level 4 neonatal intensive care unit for babies born outside of our hospital who have birth deformities, prematurity, other kinds of problems that need surgical attention or medical attention. We have a big pediatric intensive care unit, 21 beds, for kids who are injured or children with cancer or who get into extreme distress and need that kind of one-on-one bedside nursing. And then, you know, we have our standard beds. So we have all levels of acuity, including the most acutely ill children with life-threatening diseases.
I don't remember the year, but was it polio that resulted in the creation of a separate facility for children?
Right, the iron lungs, around 1950.
Just the contrast, Dr. Moreno, between the emotional needs of those kids then and sort of the isolation, and compared to now, I would assume is quite significant?
Yes, I think that's another area where we've made tremendous progress. And I think if you think within the walls of the hospital, in the past, the focus was on treating the illness or injury and getting that child back out, and that, of course, is still the primary focus. But now, when we think about things like having schoolrooms in hospitals, having our outstanding child life team, whose job is to attend to the well-being of children while they're hospitalized, our social workers, our nursing staff, we have all these layers and disciplines that really help kids in that more total health lens.
And I think of that, Paul, from a layman's perspective, of the hospital are these teams of professionals now, and just big teams of people who are seeing to the care of these kids.
The teams are critical, multidisciplinary individuals at a variety of levels, all coming together to work together and interact to provide the best care for each individual child. The differences of the physical plant itself are huge. You mentioned the facility that we moved into in 1950, the Children's Orthopedic Hospital. I had a chance to be a resident in that hospital back in 1978 before we moved to the UW Hospital, where we moved from after that in 2007 into the Children's Hospital. And many of the childhood units were large wards with beds right next to each other and very little visitation. So think about a child who's coming in for major therapy for childhood cancer, where on occasion they need to stay in the hospital for weeks or at times even for a month or longer, like for a bone marrow transplant, the first one done in that orthopedic hospital in '68.
First one in the world, Dr. Sundell.
Yes. And I feel a very close connection to that. That transplant was done here at UW by Professor Fritz Bach, who invented the genetics test that allowed matching to pick the right sibling to be a donor for that transplant. That was in 1968. In 1969, as a college sophomore here at UW, I joined his laboratory and worked with him really for the next 10 years and have continued on with that work in the research that we're doing now. But if you're going to imagine a child and their family staying in the hospital for more than a month, one needs the family to be participating in the care, because the child has to be going through so much. We need the child and the family's trust to be able to do it all. So we need the right facility that has room for the parents and knows that they're there 24 hours a day to be helping us. They're part of the team.
Before we get to the break, I feel like I would be negligent if I didn't just acknowledge that we're having this conversation, of course, in an environment of this new disease, this infectious disease that is causing so many people some concern. And we've talked about infectious diseases and the prevention of them. Is there anything that you all are looking at in this coronavirus situation that's applicable to the work you're doing at American Family Children's Hospital?
Well, I think that we are not studying it. Some of our colleagues within UW are studying it and are...
You're watching it.
Yeah, exactly. You know, I think we don't quite have as much information as we need yet. As you know, there's been some delay in having all the diagnostic kits available. So I think we don't understand the full spectrum of the infection, you know, and we're learning. Right now, there are no cases in Wisconsin.
Right.
The one case that there was, that patient did well, never was hospitalized, and is fully recovered, and there haven't been others. There will be, I'm sure, but right now we're just getting prepared.
Are there lessons that we've learned from previous approaches to infectious diseases that would be applicable to this?
Absolutely. I mean, so all of the diagnostic kits that they're working on are the kinds of diagnostic methods that we use for all other viral diseases. So that's why and the gene sequencing was immediately available, and so those things happened almost instantly in a way, you know, that you can hardly imagine. It's so futuristic. And I think likewise vaccine development will happen. It just needs a little bit of time. We have a lot of experience developing vaccines for things like coronavirus.
Right. Well, when we come back, I'd like to talk a little bit about what the future might look like for American Family Children's Hospital, and we'll do that right after this.
Not just better, it's the best Outback ever. The new 2020 Subaru Outbacks are at Don Miller. You'll get the Outback Advantage with standard symmetrical all-wheel drive and EyeSight driver assist technology. Now with the Subaru A Lot to Love event, lease the Outback Premium, $249 per month, 36 months, 10,000 miles per year, no security deposit, $1949 due at signing, or choose 0.9% financing. The Outback at Don Miller Subaru, west on Odana or east side, High Crossing Boulevard, Madison.
Don Miller.
Please join me for the 13th Annual American Cancer Society Coaches vs. Cancer Wisconsin Gala, Saturday, April 18th at the Monona Terrace. Keynote speaker, retired men's basketball coach at BYU, Dave Rose, and Fan of the Year, Palmer Wilson, will be there to inspire us as we come together on a mission to defeat our biggest rival, cancer. So come play for us and attack cancer from every angle. Get your tickets at coachesversuscancerwisconsin.org.
This election season, politicians are targeting Wisconsin, making promises and claims to capture your vote. But you deserve the truth. Only Reality Check gives you the tools you need to make informed choices. I'm News 3 Now political reporter Amy Reed. I'm breaking down political ads, explaining whose money is behind them and separating truth from misinformation. Get the facts with Reality Check, only on News 3 Now.
For 2 decades, News 3 Now and Channel 3000 have paid tribute to top-notch teachers nominated by our viewers. Every month, we spotlight and salute an area teacher, and we want to hear about your favorite. If you know a teacher who deserves to be recognized as a top-notch teacher, send us a letter, an email, or nominate a teacher at channel3000.com.
Top-notch teachers, only on News 3 Now. Follow us on all your favorite social media sites and never miss a thing. Share your photos and comments with us and stay connected.
I'm back with Dr. Ellen Wald, Dr. Paul Sondel, and Dr. Megan Moreno from American Family Children's Hospital as we celebrate 100 years of American Family Children's Hospital. The remarkable facility that we are so lucky to have in our community. As we look ahead at what's possible here, Dr. Wald, I'm struck by when we were talking about milestones, and you mentioned things like vaccines and antibiotics. But there are also things like child work labor laws and seat belts and bike helmets and those kinds of things that that contributed greatly. What are we watching now that might have a similar impact on children's health?
I think the safety issues are really key. I mean, accidents still are the leading cause of death in children over 1. So that hasn't changed. And, you know, it's interesting because automobiles sort of started to be so present in our society in 1950. So it wasn't until after 1950 that vehicular deaths became just the major cause of children dying. Yeah. And so seatbelts and then have been incredibly successful in making that better, and of course highway speed laws, things like that, and the bike helmets. I think again, you know, those kinds of safety issues are really key. And drowning, of course, now is a big key issue. It's another major cause of childhood death, and so kind of making parents aware. I don't have a fix for that one, but I think just educating people to understand that it can happen in a second, and that you have to be super vigilant.
Dr. Sondel, what has the potential for the greatest potential for advancement here?
Before getting into the cancer issue, I just want to comment on what you and Ellen were discussing. Another major risk for children, particularly in our country, is gun violence. And the American Association of Pediatrics has come out strongly with opinions regarding this. So more children die of car accidents and violence than any other cause in this country. We can do better. But next to that is cancer. And we are doing better. We're doing better because in 1950, virtually every child diagnosed with cancer was dying. Now, in 2020, roughly 85% of children with cancer are being cured. A lot of people are surprised to hear that. When we say cured, we don't mean that we're providing them a couple extra years, which would be a Pyrrhic victory. We think the cancer is going away and is never going to come back. The problem is, in order to cure those children with the modalities that came out of research in the 70s and 80s, we're using surgery and radiation therapy and chemotherapy. And while it's working, it's leaving many children with the after effects of those really major kinds of treatments. So we're trying to use treatments that are smarter and more specific. And building on the concept of immunotherapy that Fritz Bach developed here at Wisconsin is the field of immunotherapy. If the immune system can reject a transplant when you don't want it to, can we get the immune system to reject a cancer when we do want it to? That's the idea behind immunotherapy. It's now being incorporated into the standard treatment for childhood neuroblastoma, for very high-risk leukemias. And over the next 5 to 10 years, I think it's going to become a greater part of our standard therapy and allow us to maybe dial back on the amount of chemotherapy or radiotherapy that causes long-term side effects later on for some kids.
Yeah. Dr. Sandell's mention of gun violence as a health issue, Dr. Moreno, makes me think of an equally big influence in our nation, and that's the opioid crisis. And I'm thinking more, I guess, in just the environments, the traumatic environments in which children are living, perhaps, as a result of that crisis.
Yes, yes. I think one of the things we've definitely seen in this era of medicine is that the world is increasingly complex, and what kids experience can put levels of stress on them that can affect both their physical and mental health. And I think that's another area where, as a health system, we really think about those aspects of mental health and physical health and how they're connected. And I think that's also the role where multidisciplinary care is so critical. If you have a child who's hospitalized for an injury, having a team there that can address mental health needs is so critical to that kid.
We tend to look at new technology as through an essentially positive lens, that these are advancements in the human condition, and yet there are risks associated with those, right, that we seem that show up in kids.
I think that's true. I think technology is a tool, so it's neither good nor bad. And I think a lot of the research that we focus on is trying to understand the aspects that have risk and the aspects that have benefit, and then helping to work with kids and their parents on maximizing those benefits and preventing those risks.
Well, I mean, it's hard to quantify this, I guess, but the level of respect that UW Children's Hospital, that American Family Children's Hospital has globally is pretty significant, and it's a real asset to this community, isn't it?
Well, I hope that people view it that way. Yeah. We surely do. I think we've come a long way, and I think we are trying to meet the needs and exceed the expectations of the community just by our kind of awareness of all the psychosocial issues that are important to children and families, and having the greatest scientific advances that are possible to bring the best care that we can.
And the history, I mean, we didn't even mention Harry Weissman and right. You know, the elements of it that contribute to the Wisconsin health reputation in the world. Congratulations. Thank you all very much for joining me. It was a really interesting conversation.
Well, thank you for
having us. We're going to come back
and
and wrap up For the Record right after this.